Now, when health professionals refer to something as an itis, we are simply stating that some part of the body is in an irritated state. When tissues become inflamed, they will be sore, swollen, reddened in appearance if close enough to the skin, and warm to the touch. Even though it sounds scary, is actually a protective function. The local blood circulation increases to ensure enough nutrients are available for tissue repair, giving off heat and appearing more reddish in colour. The swelling is a soup of immune cells that surrounds the damaged tissue. Local nerves around the inflamed area become more sensitive and thus more likely to elicit a pain response if you try to use it. So therefore, bursitis describes a swollen and painful bursa.
But what the hell is a bursa in the first place?
Well, think of a bursa like a tiny water balloon, big enough to fit only a few drops of fluid inside it. Just like cartilage in the joints help bones slide comfortably across other bones, bursas help tendons and muscles slide comfortably across bones. Bones are not as smooth as you might picture in your head. If muscles or tendons were constantly rubbing against bony lumps and ridges as we moved around, the friction created would slowly fray and wear away muscle or tendon tissue. So bursas reduce that friction created between different body tissues, allowing them to glide comfortably over one another. Now, if you are someone who has been diagnosed with bursitis, either currently or in the past, this is the part you really need to listen to. The biggest problem with the diagnosis of bursitis is it is almost never in itself a diagnosis. It is far more often a symptom associated with some other diagnosis. Now, if I can rule out infection, you don't have cuts, you don't have any bites, and if I can rule out trauma, if you haven't fallen or banged it, then the only logical remaining cause is excessive pressure or stress on that bursa, caused by some form of muscle weakness. Weak muscles are tight muscles, and tight muscles clamp down on bursa more intensely than strong and flexible muscles. Now, this weakness could be due to either chronic underuse, acute or chronic overuse, or a muscle strain. Just like strength training makes muscles stronger, couch potato training makes muscles weaker. If you acutely overwork a muscle during a hard training session and are sore afterwards, muscles will experience temporary relative weakness while they recover. But in this example, the soreness usually fades before any significant bursa irritation occurs, unless you persist overworking it and don't allow it adequate time to rebuild and heal. If you have chronically overworked a muscle, it will probably be full of knots or tiny little micro cramps in the tissue, which create a shortened environment within the muscle, as well as reducing the available muscle tissue to recruit for strength. Now the tendon attaching to that muscle is forced to work harder and could become inflamed itself. So here the diagnosis is actually tendonitis or an inflamed tendon. In both cases, this still suggests an inability of the muscle to perform its job as well as we need it to. You may also have strained or torn a muscle. And again, it doesn't work properly when injured, so it is weak compared to its non-injured state. The client's history in combination with our assessment techniques can help physios differentiate between these possible causes. The first goal of treatment is always to reduce pain. This is achieved with a combination of temporarily reducing activities that irritate the area, as well as employing a range of physio treatment techniques based on the diagnosis. Some people think that reducing the pain means the problem has been fixed. This is a common trap people fall into. Remember, pain is just a symptom. It's just an alarm that goes off to warn you of a threat. If there was a fire in your house and your smoke alarm goes off, turning off the alarm does nothing to suppress the fire. If you don't address the fire, damage will continue and the alarm will eventually turn itself back on. If we discover that the reason for the pain alarms is weakness and we don't strengthen that weakness, alarm bells are going to keep ringing. It might be a week, a month, a year later before the alarm bells go off, but they will most certainly go off. As we strengthen muscles, they grow in size and length. This growth reduces the intensity of stress on the bursa. As the stress on the bursa reduces to a tolerable level, threat will not be identified by the brain and pain alarms will stay quiet. There are a lot of tricks physios can use to hack the mind and body and make your pain experience a lot smoother in the short term, but in the long term, removing the problem is a team effort, and our role is then to guide you through the strengthening process and reassure you as your body slowly adapts.